Paul, where should we start with cirrhosis? Like, when should we suspect it? Which groups are at risk?
Yeah, so there's a lot of ways that cirrhosis may walk through your primary care door, or you might just start to suspect it, which I think is probably what we're getting at here. I think the two big buckets that we think about that are seen most commonly are your patients who have a history, or whether ongoing or past, of high alcohol consumption, or patients with metabolic dysfunction associated with steatotic liver disease, which we're seeing increasingly leading to inflammation and ultimately cirrhosis as well. So those are the two big buckets that I think. And then there's certainly other stuff that can fall in that category, like your viral hepatitis and that kind of stuff. One patient group that Scott Matherly mentioned specifically that I had not thought of as often as I probably should is that patients with a history of Roux-en-Y bypass surgery who have high alcohol consumption. That patient group specifically are more prone to the liver injury from alcohol use than other patients, it's a group that is, I see a fair amount of people who've had this procedure. So I think it's a good thing to be mindful of. And that was neat. Maybe needs the wrong term, but a very helpful reminder from Dr. Matherly is something to sort of be mindful of when you're being concerned about liver damage and ultimately cirrhosis.
Yeah, I mean, there's a lot of patients out there right now. I guess probably over time there will be less and less if the medications keep getting better for weight loss. But this altered anatomy from the Roux-en-Y gastric bypass